Hi, my name's Jacqui.
And I'm Rachel.
And we're clinical psychologists working on the Children's Burn Service here at Pinderfields Hospital.
It can be a very stressful time for children and their families when a child has a burn injury. Burn injuries can be painful, they happen unexpectedly and often in frightening circumstances. It's completely normal that children and their parents experience a range of emotions in hospital and when you're back home. It can be upsetting for children, parents, siblings and wider family members. That's why we're available to talk to any family member on their own or together.
So, a psychologist is someone who talks with you and or your family or other important people in your life to help you and them cope with managing the effects of having had a burn injury, with treatments and with getting used to and coping with things that come up when you leave hospital and start getting back to the routines and activities that you did before the injury. This can be at any stage, no matter how long ago the burn happened.
After a burn injury, children can sometimes feel more upset generally. They might find it hard to look at the injury. They might be more jumpy or frightened, or feel scared about things now or in the future. Parents often talk to us about feeling upset or guilty. They may have worries about treatment or future challenges. And siblings can naturally feel worried about their brother or sister being in hospital and about having changes to their daily routines because of hospital visits. Some siblings might have also witnessed the accident and feel scared after this. These are just a few examples of how people might feel, and everyone is different with how they respond to a burn injury. There's no right or wrong way to feel.
Of course, it's your choice. Not everyone wants or needs to see a psychologist, and some difficulties naturally settle with time after the injury. But it is important that you know that our service is here if you need us now or in the future. And meeting with a psychologist doesn't mean that you're not coping or aren't strong. It means that we realise how stressful and upsetting things can be for families after a burn.
So if you or anyone from your family would like to meet with us, or you would like any more information, please let a member of the Burns team know. We would be happy to contact you over the phone, to see you on the ward, or to offer a separate appointment at a convenient time for you.
Hi, my name's David Aaron, and I'm the clinical psychologist based here on the Adult Regional Burns Centre at Pinderfields Hospital. I offer support to patients and family members at any stage during their burn injury, regardless of the size or severity of their burns. In fact, we know patients' psychological responses to burn injuries are not always directly correlated with the extent of their injuries. So you may experience a relatively minor physical injury, but experience a significantly greater psychological response. Also, it's possible that you may not experience psychological difficulties until several weeks after your injury. I could see you during your hospital admission, as an outpatient up to several years after your burn injury, and as part of the multidisciplinary team follow-up clinic for scar management if that's required. I also offer support for patients with decision making for further surgeries. It's not uncommon for patients to be anxious, particularly if they've had surgery close after their initial admission that traumatised them or that they particularly responded badly to, either physically or psychologically. So I could support you with the pre-surgery and post-surgery aspects of that procedure. Burn injuries often happen unexpectedly and under frightening circumstances. Everyday life is suddenly changed and replaced by an unfamiliar and distressing situation. Life that may well have felt safe becomes unpredictable and dangerous. As a result, it's not uncommon for burn injuries to impact on patients' emotional well-being, perceived ability to cope, and the way they see the world. There are unique sets of challenges at each stage of a burn injury, from the acute critical phase to coping with treatments and hospital stay, towards more long-term aspects of living with a burn injury. Some of the more common psychological responses to burn injuries that you might experience are pain, sleep disturbance, what we call psychological trauma symptoms. These include memories and recollections of the incident, flashbacks and nightmares, as well as hypervigilance to danger. Low mood and anxiety, coming to terms with the various losses in terms of physical function, social and relationship roles, as well as changes to appearance and fears of the future. The ability to cope with these challenges will differ from patient to patient. So for yourself, depending upon your history, your general psychological functioning and support networks, amongst other things. It's important to say that you might not require any additional support from a clinical psychologist. Not everyone does. Those who do can benefit from having a protected and safe space to express, understand and manage psychological feelings relating to a burn injury. If you needed help from a clinical psychologist, this wouldn't mean that you're not coping, that you're not strong, and that you necessarily have a mental health problem. It's possible that you might find yourself unhelpfully comparing to how you used to be and how you used to cope before your burn injury. It may well be that this burn injury represents the biggest challenge you faced in your life, so it's really difficult to fairly compare the old you and the new you. It might be that you would find it helpful to talk to a clinical psychologist, even if you have a strong support network. Because if family members and friends are struggling to come to terms with your injury themselves, particularly if they were a witness to the incident, it may well be that you worry that talking to them will burden them or worry them more. This might lead them to worry more about you because you're not telling them things. So having a separate space to talk with a clinical psychologist about these feelings can help you, and also your friends and family, to understand that you're receiving help and that not talking to them doesn't mean that you're not talking to anybody. So if you were to speak to a clinical psychologist like myself, it would be a different type of conversation to those with your friends and family, but also with other professionals, as psychologists are trained to understand common psychological responses to difficult situations, including those responses that you feel confused about and don't quite understand. Having said that, I always make sure that patients consent to talking to me and ensure that I provide a space that feels containing, safe and confidential. So I would hope that you would feel comfortable to share what you'd like with me. The only time I would need to share information with other professionals about you was if I was concerned about your safety or the safety of others in your life. If both you and your family members wish to speak to me, I'd make it really clear to everyone that each conversation is confidential, so that everyone feels safe to share their feelings, knowing that unless they want to, nothing will leave the room. As I work as a lone psychologist, unfortunately don't have resources to provide a different psychologist to each of you, so it would be me providing the support to everyone. It may well be that during our discussion it feels more appropriate that you receive input from other services for social or psychological needs that aren't directly related to your burn injuries. I can assist in signposting you to those services, so no conversation is a wasted conversation. If you'd like to speak to me at any point, anything from just a brief conversation about whether you want to speak more, through to more regular sessions with me, all you need to do is ask any member of the ward staff here and they can refer you to me. Any members of staff might discuss this with you and offer to make a referral if they feel it might help. It might well be that you, in talking to other members of staff, start to become aware of some psychological difficulties, at which point they refer you through to me. I can't see you though without your consent, so it's absolutely your decision. And it's not a decision you need to make straight away. It might well be that you take time to think about what seeing a psychologist would mean to you, and that as things might become more difficult, that at a particular time it feels more important to do that. So I'm here, I'm ready to speak to you, but only when you feel ready to do that.